Hi everyone, welcome back to Beyond Your Knowledge. So now we're going to be studying about the Transesophageal Echocardiography, and then the abbreviation is TEE. Okay, and then before we continue, I would like to share with you Matthew 6:1. It says that beware of practicing your righteousness before other people in order to be seen by them, for then you will have no reward from your Father who is in heaven. Okay, so now we can move on to transesophageal echocardiography. So basically, just before we continue, remember that your heart, it is in the midst of your chest cavity and the thorax cavity, sorry, and then so behind we have your esophagus and the transesophageal echocardiography. Basically, you are going to enter, so we're going to have, this is the esophagus, so we have the esophagus here, and then we're going to enter a device through the esophagus. Okay, we're going to enter this device which is called the tracheoesophageal probe. Okay, so this one is called the tracheoesophageal probe. It's going to be entering through your esophagus. Then so your esophagus continue here. Do you remember that the esophagus connect with your stomach? That should be around this area here. Okay, so it's going to connect there, the esophagus, but we don't have to go until that level, because we're going to focus more so in the area of the thoracic cavity of your esophagus and heart. So now you enter the device here. Okay, and then so in the middle of your esophagus, so anteriorly, so we have one of those chambers of the heart, which is this one here. Okay, so remember the heart has 4 chambers. I'm going to just draw it just like this. So we have 4 chambers, have 2 chambers on the top and on the bottom. The bottom is ventricles, okay, and the top is auricles. Okay, so we have your right atrium, your left atrium, your right ventricle, and your left ventricle. So then some blood vessels come, so your from your lower extremities, which is the inferior vena cava, to drain here into your right atrium, and from the top, so from your open which is going to be your superior vena cava, to drain here. Then they cross through a valve here, which is your tricuspid valve, from right atrium to the right ventricle. Then from right ventricle go to your lungs, and then come back again with oxygenated blood through the pulmonary veins. Okay, which is going to be here. Okay, through the pulmonary veins that are going to be here. And remember that go to the lung, to your pulmonary arteries. So it goes here. Okay, through pulmonary arteries to the lung. Now then one time come back again with oxygenated blood to the pulmonary veins. So enter your left atrium, and then left atrium cross here another valve, which is mitral valve, and so then enter here into your left ventricle all this blood, and then go to your body, which is going to be to your through your aorta. Okay, through all your body. So basically that was the how is the circulation in a few words. So and now let me just say, remember, or I just mentioned in the first time, so the transesophageal echocardiography uses ultrasound waves, okay, to generate the images, so from the esophagus, and then you have those images that are close to your cardiac structures. Okay, so but the one that is going to be the closest one, that is going to be to your esophagus when you are using this one here, it is going to be the so remember that we entered through tracheoesophageal here to this area here. I'm sorry, this should be black. Yeah, and then the closest one, which here, and then you're going to have some waves, so there, and then here you're going to have your left atrium. Okay, so you can see your left atrium there, which is going to be basically, so this left atrium is going to make up basically the majority of the heart's posterior surface, because remember that the esophagus is posterior and the left atrium is going to be more posterior, and then the esophagus the esophagus is very close to your left atrium. For this reason, if you have, this is one of those things, if you have the people call heartburn, so if the patient has a heartburn, so remember that we have an sphincter here, so we have an sphincter in this area here. Okay, so we have an sphincter there, so and then if you have acid, so this acid come here and then continue going up, and because you have your left atrium is very close to your mid esophagus, because the esophagus, we can divide it in the superior, the mid, and the lower. So superior, the mid, and the lower. So, and also, now that we are talking about the esophagus, let me just mention pretty fast here. The esophagus is just like this. Okay, so like this. Okay, and that is a combination of epithelium and everything. Here in the middle of the esophagus, basically there is a mix of epithelium. Okay, well, you have heartburn as here. Okay, this heartburn is caused by the acid that go up, and basically you feel that you have a pressure on your chest, and so many people, they go confused with heart attack and heartburn. Yeah, and then more important thing, so the left atrium and also the atrial septum, which is the one that divides your right atrium versus and your left atrium, and also the mitral valve, which is the one that I mentioned here into the left atrium that go through your left ventricle. So all of those things, so all those things, so your atrial septum, which is this one here, your atrial septum, your left atrium, which is this one here, your mitral valve, which is this one here. So all those can be visualized with the tracheoesophageal. Okay, now I would like to show you a picture better. I mean, this is another picture here, so let's just yeah, so this picture here basically show you how is your, this is your tracheoesophagus coming here, and your probe is coming here, and then that is going to be a light, so coming in waves here, and then you can see your left atrium, then you can see your septum as well, and then you can see the mitral valve. So basically is that. So thank you for watching, and remember, we can do all things through Christ who strengthens us, and God bless you.